In the U.S., 100,000 people have sickle cell disease. It can bring episodes of pain, anemia, and frequent infections to those affected. In North Carolina, it's estimated that more than 5,500 people have sickle cell disease. Devon Health Dr. Kathleen Elliott joins us live today to talk about what sickle cell disease is and who is affected. Thank you so much for joining us today.
Thank you for having me today.
And of course, she is also taking your questions. Text them to 336-379-5775. So let's go ahead and get started with this first question. Many people have heard of sickle cell disease, but explain more about what it is.
So sickle cell disease is a group of inherited red blood cells disorder. People with sickle cell have abnormal hemoglobin called hemoglobin S, or sickle hemoglobin in their red blood cells. So normal red blood cells are round and flexible, allowing them to travel easily through the blood vessels. However, sickle cell red blood cells are more crescent shaped. So think about a banana, and stiff, which causes blockages in the blood flow, and that can lead to various complications.
And who is most affected by this disease?
So people that are affected by this are primarily people of African descent, though it can occur in people from Hispanic, South Asian, Middle Eastern, and Mediterranean background. It affects millions worldwide, particularly in the regions of the sub-Saharan Africa, India, and the Mediterranean.
Yeah, absolutely. And talk about treatments, how it is treated.
So treatment is usually aimed at decreasing the complications related to sickle cell. So there is this medication primarily called Hydrea, which is used to increase fetal hemoglobin levels to help reduce the frequency of pain crisis and the need for blood transfusion in patients with sickle cell.
Can you talk about the age groups of when a person, could be diagnosed, or could this be any age group? Can we talk about that?
So typically, sickle cell is diagnosed at birth. It's done through a blood test that checks for the presence of hemoglobin S, and it's a part of routine screening in many countries for newborns.
Going back to treatments, what happens if you don't keep up on treatments?
Unfortunately, if you don't get regular checkup, it can lead to complications related to sickle cell. So regular checkups is important to help manage sickle cell disease, reducing the complications and improving the quality of life. So some complications that you can get from untreated sickle cell disease include severe pain due to blockage of blood flow. So these are the hallmark symptoms that can vary in frequency and intensity. You can have frequent infection. So the spleen may be damaged in patients with sickle cell disease, making them more prone to infection. And other complications include stroke, acute chest syndrome, which is sort of a type of pneumonia, organ damage, and delayed growth in children. So that's why it's very important for patients to see their doctor regularly if they have this diagnosis.
And is there a cure?
Unfortunately, there is treatment aimed at decreasing the crisis. The only true potential cure for sickle cell disease is a bone marrow or stem cell transplant. However, this option is not widely available due to the difficulty in finding compatible donors and the risk associated with the procedure. On the horizon is gene therapy, which is an exciting area of research that may offer a future cure.
Okay, and we're going to pause right here because I love how you mentioned donors, and we'll talk more about donors after the break. And remember, if you have questions about sickle cell disease, she's taking your questions, and that number is at the bottom right here. So that's 336-379-5775. We'll be right back.